Hello and welcome to the Hearing from Health Professionals Voices from the Field interview series. This is an interview series to get to know the health professionals around the world as part of the World Health Professions Alliance Positive Practice Environment campaign. And today I'm delighted to have Shiamaa Almashhadani from the UAE, and she is a dentist. Welcome, Shiamaa. Can you introduce yourself briefly?
Thank you very much, Helen. It's an honor to be here and talk about our experiences, and thank you very much for this opportunity. My name is Shiamaa Almashhadani. I work in Dubai as a dentist. I work in Dubai Health Authority. I am a general dentist. Also, I have a background in dental public health. And I'm very interested and I work a lot in preventive and promotional campaigns.
Great. Well, thank you so much for taking the time today to speak to us.
My pleasure.
Did you always want to be a dentist?
Oh, yes, definitely. I think I got very interested in being a dentist when I was very young, going with my mother to her dentist. He was a very, very kind man. He introduced so many things for me. And as a young child, seeing all these instruments and tools and materials, it sparked my interest from then. And from that, I set out to become a dentist. And I was very lucky and blessed to go through my dental college. I was very, very, very keen to work. And I felt that being a dentist, removing pain from other people, doing your job in society is something that is lovely to live for. Yes.
Great. And I understand you work in Dubai,
Yes.
the UAE, and just like everywhere else in the world, we've been through a very difficult 18 months or so. What has been the biggest challenge for you as a dentist in UAE during the pandemic?
I mean, I have to say that I was one of the lucky ones to live in a place where they really handled the pandemic very well. They took care of the people in terms of medical care, in terms of isolation, in terms of general sanitation of the public places. And I think shutting down dentistry at that time, I mean, which happened all over the world, was one of the hardest things. You can not be able to go, wake up in the morning, go and do your job, take care of these people, do the treatments that are being done, or follow up with the treatments that are in progress. I think that was the most hardest thing to do, where you will be in contact with your patients and you can't do anything for them. So I think that was one of the hardest things. You know, we had to shut down all the clinics and do a lockdown because it was an international precautionary measure. I think that was one of the things that I felt was very hard for me to do, not be able to be in contact with my patients and fulfilling their requirements in terms of treatment and follow-up.
Yes, that must have been very frustrating. So what did you do during this time when you weren't treating patients? How did you occupy your time?
Well, there was a very good opportunity, a volunteering opportunity opened for us to be part of what they call it the COVID-19 Crisis and Command Center. We were dentists, medical representatives, pharmacists, nurses. Everybody was welcome to come and join in terms of contacting people who were infected, contact tracing, making sure those who were sick get the medical attention they needed. We were straight away, there was a hotline arranged where we can answer phone calls and try to find ways to help people who are at home isolated or people who are stuck trying to go back to their home countries. There were also PCR testing, volunteering also. So there were a lot of areas where we were able to volunteer and working as medical and healthcare professionals. And I felt that this was something that as a health professional, it's time for you to step up and do something also, not just doing the normal dental work that I was there. But if I was given that opportunity, yes, I would do it. So yes, we registered for the volunteering sessions and we went there. And we helped out the people during the lockdown and during this pandemic. And it's a very unique experience with being as a dentist. This was totally out of the scope of what we were working with. So I felt that it was great for the health professionals to meet and talk and do things together, where usually you wouldn't be mingling and working together. So nurses from different departments, doctors from different aspects, and pharmacists, everybody was there working together and trying to help each other and help the public to get through this pandemic. So it was a wonderful time, and I felt very useful at that time.
That's brilliant. I've heard of this project in the UAE, actually calling for volunteers. Yeah. And I guess that helped you get over the frustration of not being in contact with your patients, but still being able to give back to society. And I guess it must have been very interesting and quite a unique experience for you to have so much more contact with other health professionals and understand the pressures that they're doing, and almost, you know, task shifting to fill that gap to be able to help everyone. Do you feel like you have a better understanding of other health professionals because of that experience?
Definitely, yes. Definitely, yes. There are areas where actually it worked both ways. Medical professionals started to understand what dentists are and how important dentistry is. They started to understand when dentists are not there, how people suffer. Then felt that, you know, dentistry is a very important aspect of the healthcare. They started asking us about what we do, what the nature of our work is, how we treat patients, what importance of it is. And at the same time, also I get to meet surgeons, and I get to meet ENT doctors, and I get to meet ophthalmologists and pharmacists and nurses. Amazing, you know, how they do on a day-to-day basis. And we used to, the beauty about it is supporting each other, you know, trying to be there for each other. When the frustration came up, when people wanted to go back to do their jobs, we were all there for each other. It's very beautiful to see like how the health professions are so linked together. I mean, what ENT doctors do is actually related to what dentists do, what surgeons do, and oral medicine doctors and all that. So I mean, it was an area of pandemic and frustration and feeling insecure because you don't know what's going, and then, you know, the fear of the unknown and how things are going to end up. But at the same time, it was a beautiful connection. Understanding each other. The value of what you do as a dentist was well understood when we were talking and explaining to them what the nature of our job was. And they spoke to us. And then we made beautiful friendships and connections with each other. So now when I have a patient who needs an ENT consultation, I have so many people on my list now to contact and talk to. And likewise, people, for example, an ophthalmologist called me and said, you know, I have a patient who's suffering from a problem in their teeth. Can I send them over? And then now we have this beautiful network, which didn't exist before, and now is available for all of us.
That's a brilliant side effect to a really difficult situation. How are you going to assure that you keep this network going forward? Because, you know, these relationships can grow and then sort of die off with time. Have you had any discussions with the other health professionals about how you can sustain this network maybe and even grow it further going forward?
I think that's a very, very good question. And I do understand sometimes at times of crisis, you get to be in a very good relation and you warm up to the people. And then after that, it starts to die away. Understand what you're coming from. And the thought came into my mind, but to be honest, I hadn't had the opportunity to talk about a beautiful project such as this one, where we can always have this connection. I think we're still trying to revive and from the aftermath of this crisis, and still people are just getting up now, dusting off the dust and getting up, trying to go back to their normal lives and getting back to working again in their normal environment, or what we call it a normal environment now for us. And this thing did come up to me. And we still have some days we go to the command center, we work with it, we still do that just to support, and we still have some of the connections. But I think this is something great that I can suggest to the people there and the authorities there in command center, and how we can keep this a network going on, and maybe have set up for a proper referral system where we don't have that very clearly, we don't have that clear line of medical, dental, referrals. So maybe that could be a start for something like that, and work on that. But we haven't done anything, unfortunately, to start that something like that.
Yeah, as you said, it's probably a little bit premature to put something formal in place, but hopefully this has sparked a few ideas, and you can keep that alive going forward.
Definitely.
And what about yourself, Shiamaa? Personally, it must have been a very difficult time. You're a person as well as a dentist.
Yes.
How did you personally manage the stress, the anxiety, your concerns for your patients, not only the dentist patients, but also in this command center, I imagine family, etc. How did you personally manage those really difficult days?
Well, I have to tell you, it had a stressful impact on me. I mean, some of the things that I felt really, really affected me was, for example, when I had to go to volunteering, I had to leave my children because they were online, and the frustration of trying to understand how to go about the education system in online. And I wasn't there all the time to stay with them step by step. So sometimes they would call me and they would cry, and that was a huge impact on me. And then when I used to come back, I was not able to go and hug them straight away. I had to go in, do my proper sanitation. I had to take the full bath every day, put my clothes in a plastic bag, do the laundry separately. And then I was able to come and, hug my children and talk to them. And I would see, like, continuously when you were in the street, no cars, no shops, everything was switched off, closed. The only thing was the ambulances, the police cars. It's huge impact on us. I mean, even talking on the phone with people who were stranded, they were not able to go back home, they were crying, they wanted to go back to their families. It's a huge stressful situation. It's mentally and psychologically affecting you, and emotionally, because you feel sometimes isolated. You feel that, will this ever end? Will I be able to go back to meeting my friends and going back to work, and my children going to school and coming back from their school, telling me about their day, having that normal situation where you can go out for a cup of coffee in a coffee shop or things like that. It was very frustrating. Although I was not locked in my house all the time, and I was going to my volunteering and still, but it really impacted me. I mean, one of the good things was that there was mental health online, where we were able to contact psychologists and life coaches if you wanted them. And those were the good things that, were provided from DHA, the Dubai Health Authority. That's the organization we work with. There was mental health online in Dubai also. And it was pure volunteering from psychologists, life coaches, mentors, whoever wanted to have a chat and talk. That was one beautiful thing. It's like giving us some tips and how to cope with all this emotional impact that we were going through. And from that also I learned how to talk to my children about things which made them a bit, because especially teenagers, they're in their social hype they want to be in, where friend contact with their friends and talk to them, and also so you need to handle that also along with all the other things you need to handle yourself. So that was one good thing we had, that the mental hotline where you were able to talk to people and get tips. And then there was the social media where they would post every day some tips for you to think positive things about the thing, how to handle things. And that actually also helped me talk to the people where I was online with, and trying to make them, feel a little bit at ease about how to handle things. So this was one good aspect I was able to work out with.
Great. And when you talk about the mental health online program, do you think, from the people you've talked to, do you think it was well used, or do you think there's still quite a lot of taboo around, especially health professionals reaching up and saying, oh, I'm stressed, I'm reaching my limit, I need help, I need someone to talk to? Do you think it was well received? Obviously, you appreciated it, but do you think others around you took the opportunity, or is it more still a bit of a taboo and we need to soldier on no matter what? What's your opinion there?
Yeah, I think it's mental health is underrated a lot, and whether health professionals or just the general society always look at it as a way of it's being a disease or something that's embarrassing and shouldn't talk to it. And I think that should be more. There is a lot of investment that in terms of, awareness, more awareness to the society to tell them that's the right thing to do. I mean, we can see now a lot of burnout, health burnout, health professionals burnout, especially those who used to work in the ER and in the ICUs and all that. I mean, they've totally burned out. They're tired, they don't have a life, they work night shifts, their normal routine, diet, sleep patterns are all changed. And I think not only those people, even the people who are staying at home for such a long time. And then now even going out in society is difficult for them because they're so used to living in isolation, and then frustrating of just having a normal conversation with other people. Anger management, stress management. I think it's all underrated. Now we have to go out and do more awareness of telling them it's right. It's the normal thing to reach out to those psychologists, life coaches, mental health support, and get use of them. Recently, I think in the FDI, they were talking about dental mental health, and even also in the British Dental Association, and I can see that in the posts on social media. I think now they're more aware of the importance of supporting people emotionally and mentally. So, because I always think is that if your tank is empty, you can't give back. And if you feel tired and stressed, how are you going to give back to your loved ones and to your society and to your people? And thinking at it from that perspective makes you understand, yes, it's important for me, not only for myself also, but for the people I loved, for the ones who are around me. And if I'm not healthy in terms of mental, emotional, and physiological, how am I going to be able to work and fulfill all the requirements of my life and my needs? So I think a lot of awareness should be placed. A lot of available resources should be there for people to reach out. And yes, maybe in an anonymous way and discreetly and in a confidential way as a start, maybe, yes, that would be a good thing. And then maybe when people start to accept it more, it should be more open to the society and talk about it more freely. So yes, I think a lot more should be placed. And I think this pandemic brought up these issues more clearly and put the spotlight on them, because before a lot of people needed it, but they were so embarrassed and felt self-conscious to go out and seek it. Maybe now it's a good time to start things like that.
Yeah, absolutely. And do you think, whose responsibility is that to raise awareness and provide those support systems? Is it the government? Is it the workplace? Or is it up to the individual to sort of put up their hand? Where do you think the responsibility lies, or how can these different elements of society work together to support health professionals?
Well, I think it should start in certain societies or unions, where, for example, the dental union or medical dental professional unions should start, supporting their workers and their members. Workplace mental health should be placed in every place, not only for the health professionals, but people who work in education system, people who work in societal system, community health centers, banks, wherever you want to go, any office, because especially now people who are used to working online for such a long time, now they're back to the workplace. How are they going to deal with each other? How are they going to deal with issues that are going to come up with their managers, for example, or directors? The normal co-workers that they used to work with and accept them. And sometimes, the frustration that happens during work, how are they going to deal with that? I think every workplace should set up a mental health, even at least just tips to go online. For example, some of the things that WHA does is that they send a daily dose of happiness or daily dose of positivity going in through the emails, where they give us such a quote from someone that's well known, or just an idea of how you can make your day pass over. And this helps a lot in making you remember that it's not about all the stress and you're not alone, but there's other areas where you can, seek out. I think working with organizations to start with their workplaces, and from there they spread on to the community. Also, social media is a good place to start, in Instagram or apps where they can, some organizations can, provide apps for individuals where they can discreetly go into these apps, learn some things about it. There was a beautiful app where there was a games for children. And each game had questions where they can cope with certain mental health, and then they move on to the next level. Let's spread this more around with teenagers and students at class. Ministry of Health, Ministry of Education, this is the organization that are responsible for these communities should step up and do something. Individuals alone, I don't think it's going to really work out, because already they're hesitant to go out. But I think it's the responsibility falls on the shoulders of these organizations, global organizations such as WHO, FDI, United Nations, bring out these things on their websites and the general, and make it more general for people to go to seek out. And maybe they can be in connection with the local organizations to set up certain websites or hotlines or apps which are provided on a general term for the society to seek out. So I think it starts with the societies, the small unions, small organizations, spread it in their workplace. And these people who work in the workplace have families and friends where they can also spread it out. And maybe do something like people who use this more, who get in contact could be, for example, advocates for mental health in their workplace. And they spread it out, give them like training sessions where they have certain certificates and they can spread it out to their friends and colleagues at work. So there's a lot of good ideas that come up. I think recently there was a mental health conference happening here in Dubai, and they were talking about issuing a white paper to talk about how we can spread all this mental health support in the society. So I think we can move on and towards these areas, and everyone can pitch in with their ideas and work in that. I mean, even if I as a person work in a clinic or a hospital, I can come up also with ideas and talk to my directors and managers about having these mental health advocates or emotional support advocates where we can support and bring in people who can give lectures and give little tips about them, have a day about mental health, things like that. I mean, could really help out.
Wow, lots of good suggestions there. You almost need to change jobs and start working on this full-time, Shiamaa.
Yeah, I'd love to.
Sounds like you've put quite a lot of thought into this and made sure that your own tank has been full even during those really difficult times. If you're speaking to the health professionals, what would be your one personal tip to make sure you keep your tank full? What do you do on a daily or regular basis to help keep yourself in a good mental health state?
I think one of the very important things is to understand that anything that's out of your control, you don't need to stress on. I mean, there's certain things that you can't do anything, whatever much stress you put in, you can't change it. I mean, just try to put your effort on the things that you are able to control and able to change. I mean, a lot of meditation is really good. I feel that when you're meditating, whether it's a spiritual meditating or it's just a physical meditating, things like yoga, listening to this quiet music, having a me time, just stop everything on that day and do something for yourself. Sit down and in a quiet, a calm area where you could just sit down and cool down and forget about everything else in life and just relax. I mean, this really worked for me. And, because being a mother and a working person, and I'm studying also, so everybody wants something from you at a time and point, and you just need to stop everything, pause, just press the pause button, sit alone for a while and do something you really love, even if it's for 10 minutes out of your time, of your busy schedule. And then don't stress out on things that are out of your control. This really, really makes a difference in life. And do something that you really like. I mean, we tend to, at the end of our day, think about, I forgot about how to do hobbies, things that I used to love all the time. We're so busy trying to run and finish things. And it's fine if you're not going to finish this assignment today. It's fine if you're not going to do this task today. Nothing is going to happen if you're going to move it to tomorrow. I mean, working on this strict schedule all the time, we're not mechanical. We're humans in the end. We have emotions, we have needs. We have to have, a time where we sit down and relax. Drinking that cup of coffee at your time and your pace will also make a difference, So things like that make you really feel that you can pass through the day and enjoy that, I'm going to have that 10 minutes for me today. So it makes you pass through the day and know that 10 minutes, that half an hour, that 15 minutes is there for me. So I'm going to sit, I'm going to relax, I'm going to do my thing. So I think that's the best thing you should do. Just put time for yourself. Don't stress on things that are out of your control. And then it's always okay not to do every single thing on my list today. It's okay if I do it tomorrow. So I think, and live the day. You never know what's going to happen tomorrow. So just live the day today.
I love that. Lots of nice tips there. And I love the idea of pressing pause and having some dedicated me time. And it's not so evident often, but it can take any form you want. So as you say, just have a nice cup of tea or coffee, or meditate, or, maybe do some music, or go for a walk, or play with your dog, or, I think it doesn't matter what you do, as long as it feels like it fills you up and you're taking time for yourself, me time. I really like that.
Yeah, exactly. And it works very well. I mean, I don't like people putting me in frames and telling me you have to do this and this so you can feel better. No, just go ahead and do whatever you love, and do that, and make it like constant. Because whenever you have this on a constant time, it will make you feel better.
Love that. Really nice, positive message. Do you have any final message that you'd like to share with the world, whether it's other dentists around the world, other health professionals, or managers of different institutions? What would your final message be, Shiamaa?
Okay, well, it's very difficult because there's a lot of messages you want to give. First thing is, sometimes people, they feel that they're weak when they feel tired and stressed, and it's okay to feel that way. It's okay not to feel positive all the time, because sometimes trying to be positive makes you feel tired and exhausted. It's okay sometimes to feel you're tired, you're broken down, you sit there, you can cry. Sometimes it makes you feel better. It makes sure that you don't have to be in control of everything around you. It's fine. Sometimes you just need to know that, I can't handle this, it's fine. And you can go and talk to someone to make you feel, even if it's just a friend, doesn't have to be a professional person, someone you like, someone from your family, just go and talk to them, take it all out. Other thing is that, yes, for organizations and managements, I think they should rethink in the workplace a time or place where people can just go and unwind. Maybe mental supporter, maybe a place like in the work area where there's a room where people can sit and relax. Overtime is an issue. I mean, support for nurses and medical professionals who've been working 24/7. I mean, giving them rewards in terms of giving them some time for themselves, support from their mental health, supporting their families. I mean, one thing that I think is important is, for example, even the workers, the female and the male workers who had families behind them left where they couldn't take care of them. Online studying, online education was a very big stressful issue for mothers who worked 24/7 and their kids had to study alone. So for maybe a support system for their families where there will be like tutoring, health. I mean, Ministry of Education did something here for parents who used to work and leave their children online studying, where they would give, for example, tutoring for their children to help them out. I mean, things like that, where workers, health workers, feel that their management is keeping their back there. We're there for you. We're supporting you because you're doing a great job. Just a pat on the back sometimes really helps to say that you're doing a great job. You're doing very well, appreciating their work. So this is the message for the managements and organizations, and for organizations that's huge, who have a loud voice in the global community. Providing these supportive programs where any dentist from around the world or any medical health professional from it can go to their website, get the support they need in terms of apps, and whether it's mental health or educational or professional supportive, online free sessions where, we can remember, the latest advance in medical or dental care, free journal access, things like that, where we can, just go back again and remember all the things that we are during this time forgetting. I mean, things like that. I mean, that would be really great. And I mean, that's what comes into my mind now as a final remark.
Thank you so much, Shiamaa. You've given us a lot of things, both personally and quite strategically, to think about. Lots of nice tips. I'd like to thank you so much today for taking the time to talk to us, and your experience and your recommendations for health professionals and the managers around the world. There's certainly a lot more we can do to support our health professionals on the ground, and to remember that a health professional is a whole person.
True.
They're not just their job, and that there are lots of stresses behind in terms of managing family, children online learning, other stresses that make us human. And to remember that, not to sort of idolize the health professionals and put them in almost on a pedestal where you expect them not to have feelings and other stresses, which obviously contribute to the way that they're able to provide care and support to society.
True. It's really a pleasure talking to you, and I'm so happy you gave me the opportunity to voice out. And I do, it's an honor, really. Thank you so much. I really appreciate the opportunity.
Thank you, Shiamaa.
Thank you.